So it doesn't pop when I push your talus down. So what's going on with you? I know we've talked a little bit and you told me about, this is primarily neck and low back. What is it?
It used to be this back spot. I used to get like, I had like a rib out or something.
Okay.
But the other day I woke up and I was so tight, like my hamstrings like connected. It almost felt like sciatic pain. And my low back was like just like hurting all day constantly. And then we decided to go down to the Greenbelt and like ride scooters. And every time we'd hit like a little crack, my neck and my lower back would like, it was like a sharp pain. Like it was weird. It was like I was in like an accident or something. It felt like, I don't even know how to explain it.
Have you ever had anything like that happen before?
No.
No.
And I've had the upper back pain, but that's it.
Anything happened in your low back a day or two before that? Were you doing lots of yard work or shoveling rock or doing something like out of the norm?
No, I've been packing, but nothing.
Well, packing. Okay, so are you moving boxes and bending and twisting?
Not really been.
No?
Not that I like, nothing out of my normal. Like I haven't even been really lifting that much because I need to pack. So.
Okay.
And maybe I was like, maybe I need to go to the gym, not take such a long break. Because maybe I'm getting old. I don't know.
At 23 years old?
Yeah.
Old. Okay. All right, the ripe old age of 23.
I'm kidding.
So scooter, hitting bumps, pain, is it just all localized to your low back and your neck? Do you have anything going down the legs or in the arms or anywhere else?
My legs felt so tight. It was weird. Like I got out, tried to get out of bed, and I literally, like, I had to have Carson push me out of bed because it like hurt. Like, even to, like, I'm pretty flexible, and like touching my toes the other day, like I couldn't even bend down and touch my toes. I was like just all tight.
Have you ever had a low back episode before, ever?
No.
So this is your first time ever having this severe of low back issue?
Yeah.
Okay. How does it feel with sitting?
When I was like, it was in pain still.
Okay.
Here.
Does it favor the right side or is it right in the center?
It's like all across the whole back.
Okay. So going through and asking you these questions, going through a history tells us a lot as far as getting an idea of what joint could be affected that's causing this. So that's why I'm asking you these questions.
I would say it's on my right side more than because I messed up my ankle, and so I don't know. I feel like my hips are a lot out of line from that.
So let's get to the ankle in a second. Tell me a little bit more about this leg and low back thing as far as, are there any positions that make it feel better?
Laying down.
Just laying flat. Okay. Standing, weight bearing, walking makes it worse?
Yeah.
Okay. So does actually walking and taking a stride, does it hurt for each step?
Yeah, it was like almost like something was slipped in like every movement. Like
Jolting hurts.
jolting hurt my, like it was like a sharp pain in my neck and my lower back.
Okay. Got it. So, and I know I'm getting into the details of this, but as you walked, did you feel like as you were striding, as you were moving a leg, it hurt, or more of the impact of your foot hitting the ground hurt?
More the impact.
Okay. So it makes me think more of it's probably disc and spine related instead of SI joint. And this might be something that you're familiar with, but in the pelvis you have the sacroiliac joint on both sides, and then you have the lumbosacral spine. So as far as the actual discs, right? And then there's the facet joint, that little joint in the back. And so these can be pain generators. The SI joint can generate pain. And we're looking for what joint or what position could be causing this pain to happen, what motion can affect certain joints. And that's how I'm figuring out what went wrong. Okay, but the bigger picture to this is, and this is something that when you move, especially depending on what we find, we should try to find someone where you move to continue this, so that this isn't just you seeing us for like emergency care and then do nothing for the next couple of years until you have a crisis again. Because from our conversations we had before, you said you have a loss of curve in your neck. Mm-hmm. Okay. And depending on what we find, if there's something we can give you as far as you do at home and you find another chiropractor over in Alaska where you're going, then they can carry on what we're doing to give you more stability and actually get the thing fixed. Right now, like anything that we can do in a couple of weeks, even though it might get rid of pain and make you feel better, chances are it's not going to fix it long term, okay? Maybe if you were 6 years old and this is a brand new thing that happened, but even at 23 years old and already having that history of that loss of curve in the neck like you were telling me, that means you've had traumas, you've had injuries, you've had things that have been building, and the straw that broke the camel's back of, who knows, you picking up a box the wrong way or something could have just flared this thing up that much further, and now it's screaming at you. And the timing is not great because it's right before you're leaving, right before you're moving. You should have hurt yourself like 3 months ago, or I could have gotten you to come in here sooner, and then we would have had a better stab at getting you stable, but we'll put the pressure on. You give us what? When you leave, a week? In 1 week. Next week you leave.
Yeah, like this weekend maybe.
This weekend. Jeez. Okay.
The 20th, yeah, I am driving.
All right, that'll be a long drive. Another thing, you said the right ankle. Did you sprain your ankle? Did you twist it, turn it in?
Time ago I heard it and it just didn't heal right.
And it pops?
I every single time. And so...
Let me see you do it again. So it doesn't pop when I push your talus down. Try it again. Okay, so that's your talus. That's the bone that misaligns when you inversion sprain your ankle. Try it again. See how it stops? It's like magic. So that means that your talus, which I'll show you when we get in the back, we'll have to check that. That's a bone right here. It misaligns forward when you roll your ankle like this. So you've never had your talus sitting in the right position. That's why it's clicking like that.
For like 10 years now.
10 years, and then ligaments remodel around it, and it's in that position. But the good news is you're 20.
It's my knee now.
Absolutely.
I think it messed up a lot of stuff.
It definitely could have. The good news is you're 23, you're not 83, so there's still time to do something about it. So, okay, clicks. When you sprained the ankle, was it bad to the point where it turned purple?
Oh yeah. I was like black and blue from here to...
And that was how long ago? 10 years ago?
How was that? Probably, let's see.
So at 13 years old?
No, probably I was like probably 14. 13 or 14.
Okay, so 9 years ago or so. All right. Jenna will dive in and grab some more information in a second. Last thing I want to explain before we get rolling. And so, as you probably know, because I know you're in healthcare, and you get exposed to all this good stuff. I'll pull this apart. This is the front of the spine. This is the back of the spine. You have a bone, disc, bone, nerve in between, spinal cord down the middle. With trauma, the bones can shift backwards out of alignment. That's called a subluxation. It's like a dislocation, only smaller. So it's a subtle little shift, causes the joint to swell, and the swelling can irritate the nerve. That's essentially what we do as chiropractors, is we're looking to find out exactly what segment of the spine has done this. And in your case, is it part of the spine? Is it a sacroiliac joint problem between your pelvis and your tailbone? Is it a sacral problem, like your actual tailbone can have issues where it can misalign, it can twist, and segments of the tailbone can I mean, there's all kinds of possibilities. It sounds like it's a lower spinal joint based on the history, but we'll do an exam and we'll see, do you have findings that point us in one way or the other, okay? Now, the reason that this is so important is more than just musculoskeletal back pain. And it's really because if you look at how the whole body works, which I know that you guys are on the same page since you're in a more natural type of clinic, but sometimes this explanation is only given in chiropractic clinics like this, and a lot of times this isn't really talked about a whole lot in like general healthcare. The fact that your brain controls everything in your body. It sends energy down through the spinal cord, comes out through the nerves, connects to the organs. So your organs are totally dependent on the energy in your spinal cord to keep you alive and healthy. So if you have a subluxation, like let's say down here in your low back, your fifth lumbar, maybe your seventh cervical, those areas now act like a dimmer switch on the wall. They turn the energy down and it can't get through from the spinal cord, out the nerves, into the organs. So over time, these organs, they get affected and they can and they can start to weaken, degenerate, even create a disease process out here. So all of this stuff out here is totally dependent on the energy in your spinal cord to keep you alive and healthy. So you can see that your posture, which is your overall alignment of your spine, is not just a thing that makes you strong and feel good, but it really affects your overall health, right? You can see that.
Yeah.
Yeah. So that's why when you move, this is stuff I really want you to take to heart, and we'll help you and we'll guide you and show you what you need to do, but I want to make sure you're equipped so that when you move, you go, great, I have a plan of attack that I'm going to follow, so that this isn't just like another chiropractor that you went to.
Yeah.
Okay? And I owe it to Leanna to make sure I take care of you too. Okay? So, Jenna is going to run through this. I'll meet you guys back in exam in just a few minutes, and then we'll get going.
Awesome. Thank you.
Yep, thank you. All right, so this measures temperature from side to side, this little instrument, and we have a GoPro on it, so you can watch the whole process. How this works, we run this down the spine. If this gives a certain reading, it tells me where there could be irritation to a nerve or where the problem is coming from. So you will get to see your back on here, and you can follow along and see this whole process. Cool? All right. All right. So I'm gonna move your hair up just like this. I'm going to go over the same area multiple times. And like I said, I'm looking for a reproducible reading, so I'll go over the area a few times to see if anything's there, and then if there is, I'll make a little mark with a skin marking pencil, and that denotes that we found a problem, and then we dive deeper. And we look for other findings that are associated with a subluxation, which is fixation of the joint, meaning the joint doesn't move properly, so I'll move you around and see if it's moving okay or not so much. And then muscle splinting in that area. And then this temperature reading, and then a big thing is edema, swelling. So like palpable edema feels like a bruise on an apple. It's pretty crazy because, you know, like in healthcare, when you think of edema, you think of someone with like edema in their legs, right?
Yeah.
Right, from like a right-sided heart failure or something. And it feels like that to a lesser degree right next to the spinous process in the spine. And that's what we feel for. And sometimes it's real subtle, but it feels like a little bruise on an apple, and it tells us a ton of information. So you have a tiny reading at the base of the skull, you have a tiny reading lower cervical, but it's there, so we'll make a mark. Okay, and I'm gonna set. Is this weird being able to see your own back?
Yeah. That hurts right there.
So like sensitive on the skin?
Right here.
Okay, let me check again. Let's see. Okay. Like sharp sensitive, or what are you feeling?
It feels like there's a bruise. Like, right there.
Let me turn this down. You're basically pegging to the left. Right there?
Mm-hmm.
Right there. I'm getting a reading right
There.
there. Yeah. That's it.
Yeah.
That's sensitive, huh? Is that a spot that's been hurting you, like this region too?
Maybe.
Okay.
Like it hasn't.
You haven't really noticed it until someone started.
Yeah, I just felt like there was a bruise on my back.
I don't see a bruise, but I can tell you from a palpation standpoint, yeah, the edema starts right there. Just drops in. Watch, Jenna, come here for a second. I just want you to see this. And sorry that we're torturing you, Marina, but take your fingers nice and light and start like this and just trace down and just see if you can feel that edema. I always want to grab you when you feel this.
Right there.
Like hug right next to the spine.
Yeah. Oh yeah.
And keep going. 'Cause it's actually more noticeable even lower.
That's crazy.
Watch.
I've never really been able to.
Watch, right? Watch. Feel right there.
Yeah. It just dips.
You feel how it falls off that little cliff right there? From there to there? Yeah. That's a good one, Marina. Thanks for that teaching moment. I'm always grabbing Jenna so that she can feel what I'm feeling, so she sees how it's like a true objective finding. Are there any exercises in the gym that hurt your low back or hurt your neck? I'm gonna pull this down a little bit.
Not necessarily. Sometimes I get sore, but other than that, my hips are tight. So anything that has to do, I just usually think it's my hips causing that.
Okay. You have a pretty huge reading right there. I don't know if you can feel that, but right there. And then a little bit even lower down into your sacrum. So you have two spots. I'm gonna mark that one. So these are the two spots that I'm seeing reading. So you have 1, 2, 3, 4, 5, 6, 7. To put it in perspective, on average, people have about 4 or 5 different spots that we'll find. You have 7. So you have a couple more than would be the average.
Really?
Yeah. But we'll investigate further to see if it's anything that we need to be concerned with. Because we don't just take the reading and then say, aha, that's the problem. You have to have some other criteria there too. But like this is really stuck in your upper neck. That's C2. I don't know if that's tender for you at all. And then your upper cervical spine, your atlas, your first cervical. Let me check. Right here. I'm gonna laterally bend you. Atlas is moving pretty good. It's C2. Just relax. I'm just tipping you side by side, side to side. Yeah, left C2. I'm gonna bend your head down. And if anything's bugging you, let me know. I'm not trying to hurt you in the process, but and try to relax. I'm just attempting to assess what your normal movement is in between these segments. Okay, bend your head down a bit. I'd say 7th cervical. 1, 2, 3, 5. 1, 2, 1, 2, 3, 4, 6. Is that sensitive up here too?
No, just that one spot.
Okay, it's quite a bit lower, that one spot.
Oh, this is right. Okay.
Yeah.
Right there.
Yeah, this is one of them. Okay. Yeah, this is the one that we dropped off earlier, right there. 1, 2, 3. That's T6. So T6. How's 10? Anything there?
Yeah.
A little bit?
Mm-hmm.
Compare it to 11.
That one.
So 10 is bad, 11 is bad. How's 12?
Not too bad.
11 is worse?
Yeah.
So 10, 11 worse, 12 not as bad, but something's still there. Because you're jumping unless it's ticklish.
No.
5, 4, 3, 12, 11. Okay. 1, 2, 6. I know, we're torturing you. We keep drilling on this T6. It's making you jump. That's bad. That's 5. 4 sensitive too? Compare 5 versus 4.
5 a little bit more.
Okay, compare down here on sacrum. We're gonna go down. This is your right PSIS, left PSIS. The center of that's gonna be around S1, S2. How's S2? Tender.
A little bit.
S3,
Not much.
2, swollen. So it looks like, just looking at your lower back, there's a little pool of edema that you have right over your sacrum and into your lower lumbar spine. So if I circled with my finger, it's like this big across. So that tells me it's probably not a brand new thing for you. It's probably been brewing for a while. So let's say 5, and then I'd flag 5 and S2, and we'll see what looks worse on x-ray. And then last thing I'm gonna have you do, you gotta keep both your feet and your knees together. And I'm gonna have you bring both your knees apart like a butterfly and back together again. And keep doing that. I'm just trying to get a feel for the joint space. Okay, then move just the right leg. And you can go a little faster with that right leg. Okay, left leg. Okay, and definitely your right SI joint is more restricted. Every time you move that left side, this whole thing just rotates around with it stuck to it. So this right side is fixated. So we have a list of things here now. So we have C2, C7, T6, T11, L5, S2, right SI joint. Okay. All right. Sounds like a grocery list.
Jeez.
All right. And so something that Jenna's doing, she's taping little BBs on your back, like from a BB gun, and she's putting those on the areas that we marked up where we found a problem, so that on the x-ray they show up like a little white dot. And then we can superimpose the exam finding on top of the x-ray finding. So it's a cool way of being able to figure out what's going on once we look at the x-rays. Okay? And you can just put your toes on that, is fine, and stand equally spaced between that crosshair. And we're gonna take a picture of you here. Definitely more of an issue with the right scapula. So the scapula should be sitting back and down like that against your rib cage. And it's really flexed forward. And that affects the shoulder, so that's something that we're looking at. What's that, pulling the shoulder back? It's a little gritty in there, but you are restricted, more restricted in the right shoulder. Does that right shoulder ever give you any problems?
Yeah.
You feel that little grinding, the clicking in there as I'm pulling it back? So there's an alignment problem with that right shoulder too. Okay, and then last thing.
Am I just falling apart at the seams or what?
Yeah, you may be. And then your feet, is that a comfortable stance for you?
No.
Stand,
I think so.
show me comfortable, show me comfortable.
No, I just have to.
So it just turns in more on that left?
Yeah.
Okay. Have you ever worn orthotics or done anything with your foot posture as far as the pronation? Like your foot's supposed to have, like if this is the floor and this is your foot should have an arch like this. And both of your feet are very flattened into the ground. And the problem with that, especially being as active as you are, when the foot pronates and rolls in, the knee turns in. And then it starts to really stress the inside part of the knee, which is the most common part of the knee that breaks down and gets degenerative, and people have knee replacements as they get older. And a lot of it stems from the feet.
Okay, yeah, I think, is this foot bad or is this?
Both of them are bad.
Oh.
Yeah, both of them are bad. And technically your left one's actually worse, but both of them are bad.
Oh.
And those are things that can be a foot alignment issue, so things that can be adjusted. However, that's not going to put the arch back into the foot. That's just going to allow the other things to work that actually help put an arch back in the foot, which is an awareness, retraining your brain through orthotic, through a functional orthotic, various exercises to strengthen some of the muscles in the foot that actually what's called supinate the foot, so actually pull it more into like a curved position. Because right now they're pronated, like flattened out. That's always something that we will look at. Yeah, like that right there is a better posture, how you just started correcting. But that has to get to the point where that comes natural.
I can feel that like in my glutes.
As far as when you do that, do that, you feel it activate in your glutes? Yeah. There you go. Activate the glutes. Okay, so let's get some x-rays on you. I'm gonna have you stand right over here. All right, looks good. Stay right where you're at. You can let your arms relax, keep your feet where you're at though. This next one, I'm just gonna have you take your finger and put it right there. Okay. Okay, good shot of Atlas. That's good. Drop your hands, but stay right where you're at with the feet. All right, show me a little bit more extension if you can. Okay, yeah, there's quite a bit more. Okay, put this little filter over the front of the neck. All right, so make sure you're glued there. Let's go again. Okay, so hold that position. Hold still, go 100%, hold still. Good job, Marina.
Depends. Like standing like that, does that cause any? Any differences? Okay, I'll keep going. Just let me know if you do feel anything different or if you want me to repeat anything.
Come on in. Have a seat. All right, so this is not, you actually get to flip around facing this way. So here's how this works. We don't have this all analyzed. We'll do this by your next visit and we'll go through it with you and show you everything that it means. Right now, this is your left, your right. We're looking at you from the behind, like we're standing behind you, okay? This should be totally straight up and down. You shift off left and then your head bends over to the right. It's subtle, left shoulder's high, right one's dropped down. There is a bit of a twist in the pelvis. We'll get all this stuff analyzed and have this marked up before we see you for follow-up. Pretty even in your leg length. You looked like you had a left short leg. You don't, but you do shift left ever so slightly. That's what I was seeing on your posture. Keep in mind too, this is a two-dimensional picture of a three-dimensional U. So there's certain things that we'll see on a patient that the X-ray almost hides. And it's kind of like, as far as how that's possible, it's kind of like if you took your hand and you took a flashlight and you looked at the shadow of your hand against the wall, and then you move your hand certain ways, the shadow does funny things. It kind of hides some of the positions that your hand is in. It's the same thing with X-ray, which is why we took all the notes of looking at your posture, and then we look at the X-ray and we put this together to figure out how to start fixing you. Can I see the lateral? The full spine lateral. All right, so this one, there should be a forward curve here. Looks pretty good. We'll get measurements on it to tell you for sure. 5, 4, 3, 2, 1, 12. If we drop a line on the back of 12, it should line up with the back of sacrum, back of posterior inferior of S1, so technically that point right there. Lines up pretty good. So you have pretty good alignment in your lower back. The mid back, you're extended backwards. 2, 3, 4, 5, 1. So if we drop 1 down, 5, 4, 3, 2, 1, 12. Actually, maybe not be too far off. It looks like you are slightly extended, which is what you were probably seeing and you said, oh my gosh, my posture is horrible. It's that some of this is shifted backwards. Your neck should have much more of a forward curve. So that's the part that's really the most abnormal, okay? So you should have a forward curve in the neck. It reverses right here. 2, 3, 4, 5, 6, 7. But disc-wise and spaces between the bone, all of them look good, which is good. So young and very capable spine to just fix some of the alignment issues, okay? Like in some of our patients that are in their 40s and 50s and 60s, now you're talking about lots of arthritis because they didn't fix it when they were younger. Now on the flip side, we have some patients in their 20s that have lots of arthritis. You don't, which is good. So even though there's alignment issues, your spine, the discs, the spaces are still in pretty good shape, which is good. Alignment issues are the best ones to have because those are the ones you can do the most with. All right, I'm gonna have you scooch back in the chair a little bit. Let me take your glasses for you too. So when was the last time you were adjusted? I'm gonna pull this up a little bit.
Last summer.
So it's been a while. Mm-hmm. Okay. So 2, 3, 4, 5, 6, 7. So we're gonna work on 7th cervical. Can I see the AP real quick? We'll set this from the left. All right, so what I'm gonna do here, I'm gonna set the bone in your lower neck forward. It'll be quick, it'll make a little sound. I'm not gonna twist you at all. The best thing you can do to help me is just try to relax. You can put your feet out in front of you on your heels, and your hands can go palm up in your lap. That's, okay, cool. I'm gonna put this behind you a little more. Are you usually pretty good at relaxing?
No.
You're not, no? All right, well, do your best. I'm just gonna tip you to the side. Try not to help me. Just be as loose as you can. Good. Let it go. Good. Chin up a little. Nice. You did good. Gotta give yourself more credit.
The nail lady gets mad at me.
Really?
Yeah, she says I don't relax my
Like your hands?
hand.
How did that feel?
Good.
Was that comfortable?
Yeah.
Okay, awesome. Come on over here. Yeah, it's set perfect. What I was going to say is that if you had problems relaxing in the past, getting your neck adjusted, sometimes this is easier to relax in because we're not twisting at all. We're just setting the bone forward. So I don't know if you could tell, but you did good. Your hands can go to the floor. Okay. So Jenna, this was T6 that we saw, right? 5, 6. Let me just look at this. 2, 6, 7. 1, 2, 3, 4, 5, 6. Yeah, so 6 is definitely where it bends off to the side. Where this whole thing starts is even lower around T11. 2, 1, 11. You also had 11, right? We flagged 11 too, didn't we?
Yes.
All right, so like clockwork, as this comes up to 12, 11's the first one that tips off. It continues, comes back, compensates back, tips off again. So technically, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6. 5. I think 5 is actually a better one to go after. Sorry, I'm not explaining to this when you're up here. I just got into it while you're laying down. Can I see the lateral, Jenna? I want to see what T5 looks like in the lateral. 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5. So in this case, we're at the toss-up between T5 or T6. We're going to look to the lateral and see if there's any information that it can give us there. And 7 to 6, we're looking to see if there's angulation. 6 to 5, is there angulation? 5 to 4. And do any of these stand out as abnormal? Looks like if anything, you're a little more flexed on this guy. 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6. It's a toss-up between T5 or T6. But when in doubt, we'll err on the side of going lower. So we'll start with T6. 1, 2, 3, 4, 5, 6. That one. Pretty much straight PR. We're going to set this off the transverse process to make it comfortable. Drop your shoulders down. Real loose. Okay, good. All right, that's set pretty well. Doing all right?
Mm-hmm.
Okay, then this one. 5, 4, 3, 2, 1, 12, 11. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. We took this little freckle/mole beauty mark, which Marina doesn't want us to call a beauty mark. And then on the x-ray, we took a washer and we taped it. This is why we do this, is so we can identify landmarks so that I can immediately go to that and say, that is T11, and look, that's T11. So I know that my count is accurate. That matters when we're trying to be specific on what segment we're identifying and adjusting. All right, I'm gonna see if I can set this with my thumbs. Let's try that first. We'll see how easy you are to adjust, but this will be more specific if we can do it. So what I want you to do, I'm gonna weigh into this piece that allows you to extend forward a bit. All right, be as loose as you can. All right, real loose. Just keep breathing normal. And let your shoulders drop. Tiniest little click. There is more. Okay, bear with me. Let's try actually having you take a breath too. Good. One more time. Good. That was better. So that was T11, this guy right here. So far, Marina, we adjusted C7, we did T6, T11, and then we're gonna set your 5th lumbar very likely. Can I see the lateral? Let me just make sure that that's, because she had some swelling down on sacrum and on 5. And then can I see the AP again? Okay. Once we have this marked up, it'll help a little bit more, but.
What are those black things on one side?
All of this is just air. It's air in your digestive system, which is totally normal.
Oh.
Everyone asks about it and everyone has it. and everyone thinks it's a problem.
Well, that I have air.
Yeah, that's right. All right, let's start with 5. So let's set L5. I'm gonna pull it. So come on over here. I'm gonna have you sit in the middle of the table facing me. And then you're gonna scoot down just a hair. Go ahead and line your side. Your head's gonna go on the paper. Legs are gonna go straight. Straighten the bottom leg, bend this top one. Straighten this. We're gonna bring this arm up like this. Cool. So I'm not gonna drop you off the table. I'm also not gonna twist you. The goal of this adjustment is to set the bone forward and not just to unzip your whole spine. So this 5th lumbar. And actually I changed my mind. I'm gonna push this. Tender? Okay. All right, roll. Okay, you're right there? Okay, let that shoulder relax. Good. Good job. How was that?
That's great.
So get up, walk around. Don't try to bend over and touch your toes quite yet. Okay, but just see how that feels with walking.
Yeah, feels good.
Okay, like good in what way?
Better than before.
Okay, good is better than before. Try doing a little test, because you said stepping was kind of bothering you. Go up on your toes. Let's just see if this, and then fall on your heels.
It's better.
Okay, cool. All right, good start. So what we'll do, I want you to start icing your low back. Here's your shades. This little card talks about icing. 20 minutes on, 40 minutes off. At this point, if you can get in 2 solid icing sessions a day, like starting today and do it tomorrow and the day after for the next couple of days, you're leaving this weekend. If we can get you in here, if there's any way to get you in here another time or 2, your next visit, we can cover all the x-rays with you once we have it analyzed. And maybe on that visit or the following one, we can map out a home care program for you.
Okay.
And then get you all the stuff you need before you leave.
Okay.
Okay?
Perfect.
Sound good? So try to see, Jenna's sending the message up front so they'll know what kind of appointment to schedule for you, but try to see if we can get you 2 appointments. Today is Tuesday. So Wednesday, Thursday, I mean, it's gonna be sequential. Are you working the next couple of days?
No.
Okay, so you're able to get in here then.
Yeah.
I mean, aside from packing and all the craziness of getting ready to leave. So do it. I know it's hectic for you right now, but if you can get in here, I'll make sure that we get you really well prepared.
Okay.
There's your stuff. You can go ahead and get changed. And we will see you, we'll shoot for tomorrow.
Perfect.
And then last thing, I'm gonna have you get changed. We're gonna have you ice for a few minutes here before you leave too. That'll be good so you don't get too sore from the adjustment.
Okay.
Okay, cool, see ya. All right, well, thanks for joining us. So thanks to Marina for letting us go through and film your whole workup and your adjustment. And we will likely do a follow-up so we can show the next step of the process. But again, if you haven't subscribed, make sure you subscribe to our channel, like it, share it, put a comment below if you have anything that you want to ask us or anything, any feedback of what you want to see more of. And Dr. Todd and Jenna over there from Gonstead Spinal Wellness. And when it comes to the health of you and your family,
Results matter most.
whoa.